This is a short presentation on anticipatory grief. We will look at what is this type of grief, the emotions involved, what we can do for ourselves during this, and local supports available. Anticipatory grief, also referred to as anticipatory loss or preparatory grief, is a distress a person may feel in the days, months, or even years before the death of a loved one or other impending losses. It is the experience of knowing that a change is coming and starting to experience bereavement in the face of that. Patients with a terminal illness, as well as their family members, friends, and caregivers, often experience anticipatory grief. However, any kind of looming change can bring on anticipatory grief. The loss of a breast after a mastectomy, a change of job, no longer seeing your co-workers every day, or the impending loss of a pet. Firstly, not everyone will experience anticipatory grief. For some, it may be that not acknowledging what is happening is a very good coping strategy, and grieving may be perceived as giving up hope. Those who are living with the knowledge of their own or their loved one's impending death can wear them down emotionally or physically. Every emotion may be felt during this time: anger, sadness, guilt, dread, love, depression, hopefulness, and relief. People will oscillate and move back and forth through different emotions, sometimes presenting with contradicting emotions several times in one day, and it's important to know that this is normal. How to support myself and others. Ask for help. Acknowledge to yourself and others if you can what you're feeling. Try not to hide those emotions, and remember that others in your circle may well be feeling the same, but no one is talking about it. Talking to a social worker, therapist, clergy person, or even a sympathetic friend may help you or your loved one manage the emotions and come to terms with the loss. If there's a support group in your area, attending a meeting and hearing how others have coped with the changes you're experiencing can provide insight and concrete steps. And learning that you aren't alone in your feelings of anticipatory grief, this can be reassuring. Start having conversations. Find ways to spend what time you have with your loved one that are meaningful to you both. Now is the time to start having those conversations you might have been avoiding. What is it you would like to say to your loved one? Perhaps think about what you might regret not having said while you had the chance. Take care of yourself. Find time for a bit of relaxation. Make time to connect with your family, to have a bath, to cook a nice meal, to FaceTime, WhatsApp, or call your friends, to breathe deeply, to read a book, and ultimately reassure yourself that you and your loved ones will be okay. Create moments. Create moments that you and your family members can enjoy. Even though you and your loved one may no longer be able to participate in activities as they could before, they can still enjoy pleasurable activities with you. In the end, these moments might be what you cherish most. There are supports available such as the Irish Hospice Foundation Bereavement Line, Solace Centre in Waterford, Hope Cancer Centre Wexford, Cushnore Cancer Centre Kilkenny, Aisht Cancer Centre Carlow, and Care Cancer Centre in Tipperary. If you're involved with the palliative team, please speak to your consultant and they will be able to refer you to the appropriate service. Thank you for taking the time to look at and listen to this presentation.